Hi, my name is Brooke Mannion, and I'm a board certified behavior analyst and co-owner of Learning Leaps Behavioral Services, where we provide ABA therapy to children with autism, primarily in the Lake County area. My company currently services 20 to 25 kids across Lake County. Most are Medicaid recipients due to socioeconomic status and our location. I know that parent letter recently went out from ACA that kind of outlined certain changes that would be happening to behavior analysis services. These are proposed changes, so they anticipated a July 2019 official rollout date. And so I just wanted to take some time, make a video for the parents who might not fully understand the implications and the effects that these changes will have on their ABA service provider. So, of course, this is my personal view on these changes and what will happen to me as a behavior analyst and to me as an agency owner if these changes take effect July 2019. So I'm going to go through the letter bullet point by bullet point, and I'm going to give you my opinion as a behavior analyst and as an agency owner. So I hope this gives some clarification and kind of lets the parents know, here's our side of it. Here's what behavior analysts are worried about, and here's what we're seeing. So the first thing in you guys' parent letter, it says, we want to help make sure your child gets all the services needed. You will be receiving a call from a service coordinator in May or June who will meet with you to learn more about your child. That sounds wonderful, and I really do want ACA to come in and meet our kids, because some of them, they need to meet. They need to see what we see every day. But in regards to the care coordinators, and determining services needed, that's my job. I'm a behavior analyst. I have a certification exam that I've passed. I have a board, a code of ethics that monitors me. I have gone to school. I have a master's degree specifically in ABA. I make the clinical treatment decisions based off of my knowledge of that kid and my educational background in ABA. My primary focus is to make sure that that child gets what they need. Sending a second person in to do what I've already done just creates more wasted time before that child gets services. Or the care coordinator might decide that they don't agree with my service recommendation, and then who does ACA listen to? Me or their care coordinator? What if they want to reduce hours? None of these things have been addressed. One of my colleagues found an Indeed.com job posting for a care coordinator for EQ Health, which is ACA, and the the education and certification level for a care coordinator is a social worker, an LPN, a registered nurse. All of these are listed. However, none of those professions have training in applied behavior analysis. So I'm not really understanding why you would send somebody in to make a decision about a child's ABA services that does not have significant training in ABA. Ask these questions, parents. Ask these questions. Ask for credentials. We have a behavior analyst certification board, board certified behavior analysts, board certified assistant behavior analysts, registered behavior technicians. Those are the 3 recognized credentials nationally. Number 2, it says, we may ask that your child have an assessment to help us in care planning. Do not worry, the service coordinator will let you know if you need to do anything. A behavior analyst who provides ABA services to your child will conduct an assessment. Our training states that is the first thing we do. That assessment tells us how many hours that child should qualify for, medically necessary hours. Again, we are certified, we have master's degrees, some of us have doctorates. We have already done this assessment. This is just, in my opinion, another way for them to stall providing services. 3, we will be reviewing requests for behavior analysis services in team meetings starting in July. We will review all of the information from your provider and other sources. You and your child are invited to come to or call in to the meetings. Your provider and child's doctor are also invited to attend. The goal is to decide what services will best help improve your child. Your doctor does not have time to attend these meetings. As a behavior analyst, I will try to go to as many as I possibly can, but there's no guarantee that I'll be able to go to every single one. I've got 25 clients. The medical doctor or pediatrician who created and wrote your referral for ABA has already decided that ABA is what your child needs. I do not think that we need to have another meeting put into your schedules to decide something that a medical doctor has already decided. The other thing is if they decide that ABA is not what your child needs, maybe they want to give you speech or OT or PT instead, these therapies are not transferable. They are not the same things. So if your doctor says, I need ABA, and someone recommends speech, it doesn't make any sense. These things should work together hand in hand. Speech, OT, they do not address behavior. That is what we do. Behavior analysts do that. 4, your child's behavior analysis provider will soon have to check in with us by phone every time they provide a service. This helps us make sure that your child is getting the services on the days and times listed on their behavior plan. You will not have to do anything. So they're asking for electronic visit verification, which means that your behavior analyst, your RBT, or your BCABA will have to call in at the beginning of every session and call back in, or use an app on a cell phone is what they said, to log in and log out. Our concern is what happens if the app is down? What happens if we have to call and cancel a session and reschedule? So now we're off the schedule that we submitted to ACA Medicaid. We asked these questions at the Tallahassee meeting on Friday, and they were unable to give us specific answers. So my concern is that this is going to cause a lot of confusion, a lot of frustration, and cause another delay in services. And then 5, we are changing the rates paid for behavior analysis services. This will not change how your child gets services. Behavior analysis services will still be available. So this is the big form of contention right now, and I'm sure you guys have heard a lot about it. Basically what happened is about a year ago when they changed the rates, behavior and analysts were able to use RBTs to utilize direct therapy, which opened up our floodgates. We were able to take a lot more kids, which was awesome. So utilizing the RBTs the way we did, it became the therapy model, the service delivery model, to basically have a BCBA who would oversee or supervise and train the RBTs. The RBTs would provide the direct service. What we did when they raised the rates for RBTs is we required more education, more training, and that they did have to be registered behavior technicians. Prior to that, they could pretty much hire anyone they wanted and just do a 40-hour training course. Learning Leaps, my company, we have 100% board credentialed or certified people on my staff. I do not hire anyone who is not registered or certified with the BACB. That costs money. These people have bachelor's degrees, intensive training, multiple years of experience. I pay them what they are worth. They are providing a medically necessary treatment to our most vulnerable populations. They deserve what I pay them. This rate increase would cause me, as an agency owner, to possibly give pay cuts to my RBTs. I did the math. I would only be able to pay them between $10 and $12 an hour. Again, someone with years of experience, a registration from the BACB, and a degree, they are not going to work for that amount of money. we are not respecting them. They need this money. That's a livable wage. They have children, they have mortgages. They are the ones that handle all of those maladaptive behaviors every single day. I already had one of my RBTs ask me, for $10 to $12 an hour, I could go flip burgers and not get hit and bit and pinched and kicked. Keep that in mind. If my staff leaves, that leaves me. I cannot provide services to 25 clients. I will have to discharge kids. And it will not be because I want to. It will be because I have to. The last thing it said is your child will continue to get services. If you have any questions or your provider says they will stop seeing your child, we will help you. That line infuriates me more than anything else. Your provider says they will stop seeing your child. I, as a provider, never want to stop seeing a child. It is because there's policies in place that will make me stop seeing a child. If I do not have staff because I cannot pay them a livable wage, I have to discharge. I ethically cannot keep a child that I know I cannot provide adequate services to. My ethical code of conduct forbids it. Please keep that in mind. We do not want to discharge kids. We do not care. It's not just about money for us. It is about providing a quality service, having a trained and knowledgeable staff. If we don't have those things, we have to limit how many kids we take into our programs to keep quality high. Parents, do not accept subpar services. Please ask about credentials, ask about their background in ABA. Make sure that you're getting what your kid needs. Don't accept rate cuts. Don't accept people coming into your homes that don't know your child, that don't have a background in ABA. These are just stall tactics. If you guys have any questions, my email is Brooke, BROOKE, at learning-leaps.com. If you have any questions, I will be more than happy to answer them. Email me. We are here. Every service provider in this state is on board. They are willing to help. We are coming together. So we have a deadline, July 1st. We really need you guys. Parents, you are the main advocates. Medicaid will listen to you. You got this pushed through in 2012. You guys will get this done. We're asking for your help. We're asking for you guys to stand up with us. There are regional meetings scheduled. Orlando's is April 18th, 10:30 to 11:30. Tampa's is April 5th, 10:30 to 11:30. So please get out there, make your voices heard, and advocate for your kids.